It is now my pleasure to welcome Joanne Chiedi. Joanne has served as the Principal Deputy Inspector General in the Department of Health and Human Services, Office of Inspector General. As the highest-ranking career official at OIG, she leads an independent and objective organization of more than 1,600 auditors, criminal investigators, analysts, attorneys, and management professionals who oversee the integrity and efficiency of the nation's $1 trillion investment in federal healthcare and human service programs. To increase the effectiveness of OIG oversight, Ms. Chiedi works with key stakeholders across the federal government, private sector, and in Congress. She is focused on delivering a smarter, more innovative, and accountable government. Please join me in welcoming Joanne.
What keeps you up at night? For us, it's our fight against federal healthcare fraud, waste, and abuse. Because this fraudulent activity hurts everyone, with increased costs for vital health and human services and potential harm to beneficiaries. At the U.S. Department of Health and Human Services Office of Inspector General, or HHS OIG, our 1,600 plus employees oversee more than $1 trillion spent for the health and well-being of Americans, including children, the disabled, and seniors. And we're delivering results. In 2018, our investigative work resulted in criminal charges against hundreds of individuals, and we expect a return of nearly $3 billion misspent dollars. Our lawyers have taken civil action against more than 800 individuals or entities. To help curb the opioid epidemic, we released a toolkit to assist our partners in identifying patients at risk of opioid misuse or overdose. And through our audits, we expect to recover more than $520 million. In fact, for every $1 we spend fighting healthcare fraud, we return $4 to the federal government. That's why our watchdog agency is an excellent investment for you, the taxpayer. Yet our work is never done. For the Office of Inspector General, protecting HHS programs and beneficiaries may keep us up at night, but you can rest easy. For more information, visit us at oig.hhs.gov.
Lori, thank you for that very kind introduction. So I want to start this morning off by asking you all a question. What keeps you up at night? For me, I know a lot of things, your kids and everything, but what keeps you up at night? For me, as you can see from our video, it's protecting beneficiaries, making sure they're safe, protecting patients, protecting people. It hits home for me, as I'm sure it does for many of you. So that's my mom and dad. That's my older sister, Yoli, my older brother, Anthony, and that's me in the middle. I am the youngest. Many of my childhood memories revolve around food. Sunday dinners were very special in our home. Preparation started very early in the morning with my mom making the sauce and my dad rolling the fresh pasta. Soon, our home would be filled with family and friends. There was lots of excitement, lots of laughter, and it was very loving. My parents were married in 1949 and immigrated from Italy to this country in 1956 with my sister Yoli. When my dad was dying from complications of dementia and diabetes, hospice caregivers sat with him, provided pain relief, and helped him be comfortable. And they gave my mother a peace of mind that the love of her life for over 60 years was receiving kind and respectful attention in his final weeks. To this day, my 96-year-old mother calls those caregivers angels. And that's the type of care we all aim to provide. So I'm very excited to be here with you at this incredible Compliance Institute. I'm joined here this week by a dozen of our top compliance professionals who will share our work with you in a lot more detail than I have time to this morning. So please check out their sessions. You won't be disappointed. I'd like to focus this morning on oversight and compliance at this time of disruptive innovation in healthcare. You can conceive or build almost anything today, whether it's artificial intelligence and machine learning, robotics, genomics, a smart pill, or using the ability to use technology to provide ICU services in people's homes, in your home. We're living in an amazing technological age, and the changes are coming fast and with serious consequences for those who don't keep up. At OIG, our mission is serving beneficiaries, young and old. My team tells me I'm all about the people, and they're right. Behind every data point, every evaluation and audit, every enforcement action is an individual who depends on us to do our job every day. And we serve a function like the one you serve in your organizations. Our objective is to help our department thrive. Our organizations depend on us to assess risk and provide recommendations to correct and prevent problems. And we can make a real difference in helping innovations deliver their promised benefits, free from the costs and the risks of noncompliance. To provide effective oversight, we need to understand how healthcare is being delivered today and how it will be delivered in the future. We cannot oversee what we don't understand. Across the economy, the disruptive force of technology is killing off older companies earlier at a much faster rate than decades ago. Past dominance no longer guarantees future results. According to a team of analysts at Credit Suisse, the average age of a company listed on the S&P 500 has fallen from almost 60 years in the 1950s to less than 20 years currently. Who here remembers Kodak? Okay. Kodak was the 800-pound gorilla in the world of photography. But after over a century of dominance, it crumbled because it failed to keep up with the digital revolution. Those who sit still fall behind and disappear. We need to understand the trends and have a strategy to take advantage of innovation. I believe compliance will be more important than ever to help ensure that investments made in innovative healthcare deliver benefits for patients, providers, and payers, free from the corroding effects of fraud, waste, and abuse. When it comes to compliance at this revolutionary time in healthcare, don't shy away from technology and innovation, embrace it. There's too much at stake for patients, providers, and for your organizations. So my main message to you is this morning. Be bold, take action. Compliance must have a seat and a voice at the innovation table. Now, I want to talk about how oversight and compliance relate to the evolving healthcare ecosystem and share 4 strategies and practical tips that OIG is using to prepare for the future. And we'll be posting a handout later summarizing this presentation on our website. So feel free to sit back and relax. No note-taking necessary. So to begin, let's consider how oversight and compliance can protect and shape the new healthcare ecosystem. At the center of the system are patients and their families. Patients are reimagining how and where they want to receive healthcare. And it's not necessarily at the doctor's office or a facility. Those walls are thinning. Patients are becoming more empowered consumers, making decisions based on data and using technology to find and receive services. Patients will have better access to their own medical records and new resources from health-related data from wearables and apps. Next are the providers and the payers, who most of you represent, who are rethinking how they want to deliver smart, quality care to the consumers. Supporting the patients and the providers are the innovators and the scientists who are inventing new digital health technologies, new healthcare delivery models, and new clinical treatments. Now, many of these innovations will improve care, ease clinician burden, and decrease costs. And some will not, and that's the nature of innovation. Which brings me to the role of oversight and compliance of this ecosystem. Our role is to ensure that the rules of the road are followed, that dollars are well spent, and that patients are protected. Like innovation, compliance should never stop, should never become stagnant, and will be essential to the success of the new healthcare ecosystem. Compliance may not seem as exciting as all the disruptive innovation, but it's the foundation, it's the glue that holds everything together. And it should work alongside innovation. So how does compliance get a seat at the table to oversee this new environment? You're the experts at risk management, understanding incentives, designing policy and procedures, and knowing the rules of the road. These characteristics will be critical to ensure oversight and compliance are not an afterthought. They must be front and center. When it comes to innovation, you want to harness all the benefits while minimizing the risk. And that's what we all call risk management. Compliance can and will play a vital role in getting innovation right in healthcare. So let me share 4 oversight and compliance strategies we're using to prepare for the future and some practical tips for implementing them. The first strategy for future success is agility and adaptability. Being nimble and being able to adapt to change is critical. For OIG, we have built a multidisciplinary workforce with the freedom and the skills to work in new ways across our organization to identify program vulnerabilities and to bring new insights into how to address them. For us, this meant building up our data expertise and providing tools to our mobile and diverse workforce. We use evaluators, auditors, investigators, and attorneys, but we also use clinicians, economists, data experts, and cybersecurity experts. We put a lot of different experts at the table, armed with data and technology when we're looking at problems at HHS programs. Here are some pointers for becoming more agile and adaptable. First, review your staffing plan and be sure you have the right mix of experts. Second, use your organization's data to identify clues to your organization's soft spots and liabilities before they come to the government's attention and potentially become bigger, more expensive problems. Now, I understand that some of you may not have the kind of access to data that you need to do this effectively. If the leaders of your organization were standing before me today, I would implore them to give compliance the data. If anyone in your organization has data, you should have access to it too. I would say, if you want to predict and manage risks, if you want to delve beyond what happened to explore why, give compliance the data, give them C-suite support, and the freedom to do their jobs. The second strategy is continuous prioritization. To respond to rapid change, we engage in a process of continuous prioritization. This involves scanning the environment early and often with multiple lenses. We look around at the current state of play and at the horizon for emerging issues. We convene senior leaders across OIG. We discuss ideas for new projects and changes in directions for ongoing projects. We now have a dynamic living work plan instead of a once-a-year publication that quickly became outdated. Current priorities for OIG include the opioid epidemic, cybersecurity, Medicaid program integrity, care in home and community settings, managed care, value-based care, and keeping kids safe receiving services from HHS programs. Here are some practical tips for continuous prioritization. First, support a culture that allows for experimentation. If the culture allows no room for failure, people will be afraid to try anything new. Second, set up a regular process for environmental scanning and prioritization of your compliance activities. And third, list your priorities and be open to reassessing. And then ask yourself whether you're skating to where the puck has been or to where the puck is going. The third strategy I want to share is what I call compliance leadership. Compliance leadership is about a clear vision, empowerment, being passionate so people can see that you care, so that when you're sitting at the table, your voice is heard. For OIG, this means finding out what's happening in HHS programs and asking program officials what's keeping them up at night so that we can get involved before things unravel. We aim to promote program integrity as a front-end consideration for HHS programs, particularly for new and emerging healthcare models and technologies. We disseminate a clear, simple message about our values, our vision, and our priorities. We follow the facts wherever they take us to root out fraud, waste, and abuse. For OIG, it's critical that we do this right, that we do the right things, that we show people we care, and that we support them. Here are 2 tips for implementing compliance leadership. First, seek a meeting with the people planning your data and technology functions. Here are a couple job titles to look for. If you have a chief technology officer, a chief innovation officer, a chief data officer, or a chief strategy officer, make an appointment and find out what they're working on and what's keeping them up at night. If you're a smaller organization and don't have folks with those titles, reach out to the head of your IT department. Find out what they're investing in. Then look for opportunities for your compliance team to help improve their chances for success. Second, get a seat at the table so that innovations are done in a compliant way. For some of you, it might be hard when it comes to data and technology. Some may think that's not in your lane. Well, getting in early and often can avoid costly mistakes and retrofitting down the road. And maybe you'll find new opportunities to use your organization's data and technology to improve your compliance programs and operations. The last strategy I want to mention is strategic partnerships. Partnerships are more vital than ever in this complex, disruptive healthcare world. Working with mission partners who share your passion for oversight makes a huge difference. And it's not healthy or sustainable to go it alone. To this end, OIG has a wide range of partners, including DOJ, state and local law enforcement, GAO, Kim at CMS, and other HHS partners. We also have private sector partners, including here at HCCA. This helps us understand the needs of industry better. We devote substantial resources to educating providers to understand the relevant requirements and to promote program integrity. So how do you find strategic partnerships? First, meet here at HCCA. There are many potential new partners that can help you. Second, identify your organization's partners and reach out to their compliance offices. And third, get to know all the department heads within your organization and maybe start with IT. So in conclusion, these are the 4 strategies that you can start implementing on the day that you return from this conference. Agility and adaptability, continuous prioritization, compliance leadership, strategic partnerships. Here's the highlight that I mentioned that's probably posted right now on our website that summarizes this presentation. Please share it broadly. Businesses that plan to be around for more than 15 or 20 years will embrace change. And they will also have their compliance professionals working shoulder to shoulder with their disruptive innovators. It's the perfect marriage. Compliance meet innovation. So whenever I needed a pep talk, my dad would sit me down and he'd say, "In America, niente è impossibile. Dobbiamo solo credere che si possa fare." In America, nothing is impossible. We just need to believe that it can be done. Together, we can help ensure great health care for individuals, young and old. People like my parents, people like your parents, families, because people are at the center of what we do. Thank you and take care.